Hello, I'm Eka, co-founder of Clinova's clinical trial recruitment platform for emerging markets like CIS and non-Eastern European countries. We've spent years running clinical trials across the region. And during this period, we found out that finding eligible patients was always the biggest bottleneck, because it needs 4 to 12 months, and around 80% of clinical trials are delaying, costing sponsors up to $600K. The process is still manual with spreadsheets and phone calls and prone to errors. And what makes things worse is that here in a CIS region, hospitals lack structured health electronic records and the system is fragmented. That's why we built Clinova, clinical trial recruitment platform specifically for this region. Clinova installs directly inside hospital systems, analyzes any type of data, including handwritten or typed, and matches patients in minutes. For contract research organizations, as we call CROs, they upload trial criteria onto our platform. Our AI, hospital's AI, screens any type of record, then matches the patient, anonymizes the patient, and after the consent is done, the enrollment's complete. We make money through charging per CRO, and the average ticket size is $1.2K, where we share 20% commission fee to hospitals. We target $36 billion market, where our sum is $360 million based on 300K patients we can enroll. We acquire CROs through leverage direct sales and industry events and conferences. Unlike our competition, we transform any type of data, including handwritten or typed or scanned PDF files, and we make this matching in minutes, not months. So we are a team of deep experience in CRO as well as in hospital management industry. And our CTO has built AI health tech in Ukraine and Poland, so we know systems gaps and how to solve it. In our 3 pilots, we've matched 184 patients where success rate exceeded 94% in 6 active trials. And also we signed 20 LOIs from CROs eager to collaborate with us. And also we raised $50K angel investment. This is, thank you.
Okay, great.
Okay, so the elephant in the room is regulatory. I mean, so in Georgia, you can go pay a hospital and say, could you please scan all your patient records for us, and so that we can acquire patients for a clinical trial? Is there no regulatory barrier to doing that?
The hospital records, all the hospital records should be digitalized. Yes. There is a law from 2020.
Right.
So they, they scan the records, which are handwritten, and they just upload.
Right.
And this is manual process.
Right.
And if they want someone to participate into the trial, they do it manual. They do manual filtering. They just call, etc. And the process is quite slow.
Understood, understood. What I'm saying is, I believe, and maybe I believe in the United States, a third party cannot pay a hospital to review patient records for the sake of recruiting them to a clinical trial.
So, yes, I get it.
Okay.
Yeah.
So is that not true here and in Eastern Europe?
No,
or
this is the problem, exactly.
Okay.
This is the problem.
Okay, so how do
'cause
you handle the regulatory barrier?
Yes, regulatory barrier. Also, we anonymize any type of patient, and only after their consent, their information is shared with CRO, like pharmaceutical companies or other companies.
Okay, so when you go to a hospital, the hospital has got to go to the patients and say, will you consent to have your records reviewed
Yes.
for a clinical trial?
Exactly.
That's the cycle you go through.
Exactly. They either ask doctors to find eligible patients,
Right.
or either they post ads to participate, or maybe through like agencies who do this recruitment manually.
Okay,
gotcha.
okay. So in your experience in your trials, when you went, you've worked with a couple of hospitals, so how many of the patients that were asked agreed to allow their record to be reviewed?
Everyone is anonymized. They have codes, like for example, patient this with the ID code,
Yeah.
and 11,000 patient records was scanned in 3 pilot hospitals in 6 active trials.
Okay.
But they were anonymized.
They were all anonymized until
yeah.
the match. If the match is found,
Right, then they call.
then they get notifications through email.
Okay, so that's
Yeah, they
the trick.
pre-qualify
Yes.
with anonymized data.
Okay,
Yeah.
so you're scanning, that's the
Yeah.
trick, is you anonymize the data and then you ask permission.
Yes, if the
That's-
match is found, yes.
Yeah, if a match is
Okay.
found, only
Okay,
of
so
the good
you
matches.
do get to see all of the records, not just the people that respond.
Our
That's-
AI power does it.
Yeah.
Right.
What's the conversion rate so far of the people? I know it's very, very early, but you've reached out and said, hey, there's a match. Let's say, how many are you sending out and how many converted? Do you know?
We had match 184 patients.
Right?
Okay.
And 11,000 patient records has been analyzed. Yes.
Right, and then of the 184 matches,
How
how
many
many consented
Yeah.
to participate?
80 was enough to make the trial. Like if in the trial 80 people, patient gives consent, then trial is done. We can generalize the results.
Okay, so of the 184, you got 80 to
that right?
consent.
Yes.
That's what you're saying.
And then you
Okay,
stopped
so-
at 80. You didn't try to get more because that was your limit?
No, we have our KPI. We want to enter in 10 active trials. We've already covered 6 active trials, and we are on our pilot stage. So after we finish these 10 active trials, then we will have achieved our KPI.
Okay, so your CAC is at the patient level? Is that how you're measuring CAC? So your customer acquisition
Our
cost.
customer is a CRO, contract research organization, who pays for the research, who pays for the trial.
Right, okay, so your customer is the CRO.
Yes.
And you're, okay, I'm sorry. All right, I misread that. I thought you were saying $10, it's $10,000.
Yes.
Yeah.
All right, okay. Okay.
Questions,
What
guys?
does your revenue look like, and how many of these CROs do you have that you can go after?
We have
I'm
we
curious, are they
need
mostly-
minimum 2 clinical trials, and we have around 20 LOIs for now from CROs.
I'm trying to understand your total market, addressable market. So how big could this be as a company?
$320 million, 300,000 patients approximately.
Who's got a TAM Samsung?
Okay, I missed that. Okay.
So how much so have you already generated the 96K? Was that
We
that
have not
happened?
started generating yet. We
you
are on
haven't?
our beta stage. Yes,
Okay.
pilot stage, and after we launch, then we will start generating
Okay, so the
revenue.
beta was free, right?
Yes.
Basically.
Yes,
Okay,
yes.
that was okay. And then when is your launch?
By the end of November, as
Okay.
we calculate.
Okay. And then what's your pipeline? How many trials do you have in your pipeline?
We want to cover around 10 to 15 trials in
Okay.
1 year.
In the first year?
Yes.
You think you can do 10 to 15?
Yes.
And
Okay.
you've got LOIs with 20 different CROs right now?
Right now, yes.
And
Okay.
are those all in Georgia? Those CROs?
No. I
No,
heard-
in Ukraine, we had pilots, one in Ukrainian clinic and two in Georgia.
Okay. All right. Okay. So, and so who do you consider to be your competition? I mean, so, right?
So we have indirect as well as direct competitors.
Right.
Our indirect competitor is in our region right now is manual filtering and agencies who do spreadsheets, phone calls, etc. The process, manual
Right. So
filtering.
there are agencies that
Yeah.
CROs hire to go find patients,
Yes.
right? Okay.
And we also have direct competitors, but these are Western solutions. For example, Oasis Now,
Okay.
who they are quite new. They are only 1 year in the market. They are also AI-based,
Yeah.
but they work on very structured Western, like EU records and system. And our system is very unstructured. Records are handwrittens and scans, etc. They in EU they all have already digitalized and very structured.
Okay, so, because I know there are people like you in the United States, right? I mean, I'm just wondering, is there a playbook? I can't remember the names of anyone, but is there a playbook that you're using that, that some other companies in Western Europe and the United States have already proven? Do you know what I mean? When I say playbook.
What are you learning from other companies around the world that have built businesses similar to this?
We are learning, and now we are concentrating in integration standardization. Clinova software needs to be installed in unstructured systems, and each hospital now uses different models. So this is the point where we share others' experience and we learn from others' experience.
Okay. So who is the most successful at this in the West?
So right now, Oasis Now. Oasis Now.
What
right
is now is the
yes.
most successful at this so far?
Yes.
And they're in
but
Europe?
They are new. They are new.
Yeah.
Yes.
Huh. Okay. All right.
There are
Okay.
some unique challenges in the countries that you're targeting. So you're targeting CIS and non-EU Europe, right? And there are some unique challenges, right? Because the data tends to be more fragmented
Yes.
and less structured. And so what works in the U.S. is not doesn't necessarily work here because the data structures and data sources are completely different. So you wouldn't really want to follow best practices from the U.S. because you're solving a much different problem. Am I
Yes.
accurate?
Yes, and in every hospital, our AI is trained and keeps getting better and better. And when we will have presence here, so we cover this unstructured and fragmented system.
Yeah.
Yes.
Structured and fragmented data. That is the essential challenge. Right.
Okay.
Nice job.
Very
All right.
nice.
Thank you
Thank
so
you
much.
very much.
Thank you.
Thank you.